let's get into mushrooms.
Yeah, please. I would love to get into the sacred plants because I do feel like there is a little bit of a difference. And as I always try to compartmentalize that a little bit, and I also think there's something in the consciousness, the public conscious, around naturalism. So a lot of people who are turning away from the chemical-based model, we sort of overcorrect when we a little bit, and I think that wound creates a space for a lot of these plants a bit more. They're natural. There's no corporate like distortion on it. So please, like, talk about psilocybin.
Yeah. So psilocybin. Johns Hopkins University has a super well-respected research lab. They've been at this early in the second wave, if you will, or in the early 2000s. Roland Griffiths heads a team there, and in 2016 they put out findings of one of their research studies around life anxiety or life-threatening illness. So they gave cancer patients psilocybin, and they wanted to see what that would do for their anxiety/depression.
Palliative care? Or
Not
was it a bit
palliative care,
because they're not
but it
end
was
of life?
life-threatening.
Wow.
So they could have died through this. And so you imagine, most people would probably freak the fuck out with a diagnosis like that, and then the treatment and the
it would lower your immune system too. So you're trying to fight this thing, and the stress of the situation is hurting your ability to fight it in the first place.
That, and also even closing you off. Pain has this thing of just bringing us in a survival way, which then cuts us off from our amazing resources of friends and family and others, pets, all the things. So they gave psilocybin, the active ingredient in magic mushrooms. And what they found was that there were rapid and large effects of decreasing anxiety and depression. So this was excellent news. I'll come back to why the rapid part is so important. But jumping to in 2020, they did another study that built on this, because there's a lot of different types of depression. And that type of depression that was in response to a diagnosis and an illness, the study that they published in 2020 was around major depressive disorder. So this is a different kettle of fish and a much bigger pond, if you will. It said that 10% of the U.S. population would meet the criteria for major depressive disorder. So they wanted the question they were asking, how would psilocybin treat this different type of and wider ranging type of depression? And here's what they found. Drum roll. Spoiler alert, it's awesome.
Right, crushed.
They gave participants 2 doses, spaced out, 2 separate doses in a controlled supportive setting. And what they found is a rapid and significant decrease in anxiety and depression in the majority of the participants. And even within that, half of the people in that study no longer qualified for the same level of depression.
Right.
They were lower. They were dropped into like a more normal range of depression. So a couple things with this. I mentioned the rapid. A lot of times, and the treatments out there for depression and anxiety, they often take weeks or months.
Yep. I was on pharmaceuticals for depression and anxiety, and was significantly healed working with psilocybin mushrooms. And my brother Shane was, I would say, severe depression, because I remember before he worked with mushrooms, I woke up, we were at a hotel in New Orleans, and I heard crying, and my brother was on the ledge. In the middle of the night, I woke up and I'm naked, asleep fucking naked. And I run out and grab him and just hold him, and he's just crying, so he can't do it anymore. And like 6 months later, worked with mushrooms and healed him like that. Done.
Cue the goosebumps.
He's one of those well-adjusted, beautiful men I know. Yeah.
Beautiful.
Yeah. So point is,
the rapid,
absolutely.
Yeah. Yes, absolutely. You're full on board.
110%.
So there's the rapid level of the treatment, and there's also without the undesirable side effects that so many, maybe you can speak to that, the side effects, unwanted side effects that can come with pharmaceuticals.
That's the thing. Pharmaceuticals being on pharmaceuticals and thinking you're healthy is like taking a loan out from a bank and thinking you're rich.
I love that.
You're not. You're just putting you're putting a Band-Aid on a gunshot wound, and the person that needs an on switch needs an off switch, and it begins this cycle of abuse. It perpetuates the consciousness, the placebo consciousness of believing that something is wrong with you and you need an outside substance to heal it, and that in itself is a disease and a diseased consciousness, and it's very much a metaphor for all of the problems we have, and for you to perpetuate that model that you need something else or someone else to heal you or for you to feel right, and something else once you crash from the meds to make you feel right again. It is a completely fallible way of being, and it's antithetical to healing once you really understand how to heal oneself.
Yeah. Man, spot on. And it really brings up the point of a paradigm shift.
Right.
So
and this is what this is. Yes.
And so traditionally, psychotherapy, great, obviously, I'm biased and a big fan.
It's amazing.
And it can, even with the advances in the movement towards somatic-based trauma healing.
What's somatic-based?
It really brings in the wisdom of the body. So we're accessing, it's not just talking about the story, but it's listening, it's noticing sensations and letting the body kind of speak and bring that in. So that's coming out more and more. But even with that, by and large, traditional psychotherapy stays a bit intellectual, cognitive. Psychopharmacology, medicines, they're kind of throwing medicines at people for different things, and then medicines to help with the side effects of that medicine, and there's downsides to that. All along, people are coming to therapy because they're simplified is they're stuck in someone. They're suffering and they need some change. And so the paradigm shift is enhanced therapy, or using medicine along with counseling or psychotherapy in a way that, sure, biologically for a while we can turn down the fear, we can increase the trust and empathy and revisit traumatic material, or we can have with ketamine the space from certain aspects and then kind of get a different perspective from that. So we're using the medicines, plant medicines, synthetics, in conjunction with therapy that support people to go beyond the medicine experience and integrate things into their life.
That's so amazing. The importance of having, people call them many different things. You call it, a shaman, a guardian, a guide, a doctor, the importance of that. And one thing I love about you and I love about the work you're doing and how you're training people to do this work, it's so important for me, being someone that was drugged since I was a kid. If you're working with someone, having it be someone who's worked with the medicine they're giving you, to have these doctors giving me stuff that they wouldn't take, I'm like, it's just a completely flawed model. And any, medicine woman or medicine man who I've met outside of the West or worked with, they were just someone who had healed themselves, and often who had healed what I was dealing with, and they knew how to do it. And that comfort, I just think that's another fallacy of the Western model, is if they're not going to if they wouldn't take what they're giving you, then they shouldn't be giving it to you. Yeah.
As far as medicine in this space, I totally agree. Right. To be in deep relationship with the medicine that they're facilitating. Of course, there's a place for all of Western medicine. If there's a trauma, impact trauma, car accident situation, I want to go and I want to get, the medicine and the things that take care of that acute situation. But this different model of accessing, empowering an innate inner healing capacity. And it's really important, as you were pointing to, not only our own kind of, if we talk set and setting, is the mindset. And the mindset not only of the participant or the one doing the journey, but also of the facilitator, whether that be a licensed trained therapist or a guide or a sitter. So the mindset, and this is where, my wish is for everyone to have a super experienced, well-trained therapist at their side for all that. And the reality is that's, there's a bottleneck. As of years ago, the demand outweighed the supply, and that's only going to increase as we're going to shift that. But the demand, as more research comes out from these institutions, it's going to grow. So we want to bring a lot of care not only intelligence, knowledge about the substances that are being used, but the ethical and safety components of this space.